everyone, or good morning to those joining us from the West Coast today, and welcome to today's webinar entitled Engaging Policymakers on the Commercial Determinants of Health, Lessons Learned from Global Tobacco Control. My name is Selena Degano, and I'm a Senior Program Specialist here at Public Health Ontario, and I have the pleasure of moderating today's session today. Before we move forward with the presentation, we would like to first respectfully acknowledge that we are participating today on traditional lands of many nations, which have inhabited from the beginning. As settlers, we're grateful for the opportunity to live and meet here, and we thank all the generations of people who have taken care of this land for thousands of years. I would like to acknowledge that today I'm participating from Toronto on the traditional territories of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nation, Inuit, and Métis people. Please join me in acknowledgement and respect of all Indigenous peoples, their life journeys, and worldviews. We would also like to respectfully acknowledge that any reference to tobacco in today's presentation refers to commercial tobacco use, which is not associated with commercial tobacco use, which is not associated with sacred and traditional uses of tobacco, which some Indigenous people have been using for thousands of years. Traditional or sacred tobacco differs from commercial tobacco, both in the way that it is harvested and the way that it's used in ceremony and prayer, often for healing and purifying. So before I introduce today's speaker, I just wanted to take a few moments to highlight World No Tobacco Day. So this is our World No Tobacco Day webinar. And the theme this year is Unmasking the Appeal. And the goal is to expose the strategies used by the commercial tobacco and nicotine industries to make their products appealing, particularly to young people. And I just wanted to let everyone know that the WHO had hosted a webinar specifically entitled Exposing Lies, Protecting Lives, Unmasking the Appeal of the Tobacco and Nicotine Products webinar earlier this month. And there is a recording available, which I will pop in the chat shortly for those who may be interested in watching that at a later time. And this is sort of a nice transition into our presenter today. So it is my pleasure to introduce our speaker for today, Dr. Kelley Lee. Dr. Kelley Lee is a Tier 1 Canada Research Chair in Global Health Governance at Simon Fraser University and affiliate professor at the School of Population and Public Health at the University of British Columbia. She currently co-leads the Bridge Research Consortium to support public trust and equitable access to new vaccines and immunotherapies as part of Canada's biomanufacturing and life sciences strategy. She's on the editorial board for the World Health Organization Global Report on the Economic and Commercial Determinants of Health. She is a fellow of the UK Faculty of Public Health, Canadian Academy of Health Sciences, and the Royal Society of Canada. And thank you so much, Kelley, for joining us today, and we look forward to your presentation.
Thank you, Selena, for that lovely welcome, and to Public Health Ontario for inviting me to speak. I'll just share my slides. And it's great to be here. I'm not working on tobacco control anymore. I shifted in 2020, but I have been remaining in touch with the commercial determinants of health work. And I always draw on my former tobacco control research to illustrate a lot of what I do. And so I'm really delighted to share some of those insights with you, and hopefully they're useful to your work as you go forward. I just also want to acknowledge that I am respectfully joining you from the unceded traditional territories of the Coast Salish peoples, including the Tsleil-Waututh, Coquitlam, Squamish, and Musqueam nations upon which Simon Fraser University Burnaby campus sits, here just outside Vancouver. I want to hopefully leave you with 4 learning objectives, or meet these objectives. And so when you go away from this session, I hope you'll be able to define what are commercial determinants of health and how they support understanding of key factors shaping health and disease in the 21st century. So what has changed? What is different today? describe how the commercial determinants of health can contribute to both harms and benefits to population health. We often focus on the harms. I want to try and get across that there are both positive and negative outcomes. I want you to recognize the opportunities and challenges for bringing together research and policy communities on the commercial determinants of health, and I'm really delighted to join you for that very reason. And then finally, to identify strategies for using the commercial determinants of health to build policy alliances across different public health issue areas. I know most of you are working on tobacco control, but many of you are working in other areas, and I think they're very important alliances to be built across those. So let me start by saying that when I started my career, I focused on something called globalization, which is something, of course, we all talk about today. It was in the late 1980s when globalization started to unfold the process on the world. And so accelerating fast forward today, many decades later, the world economy and even our everyday lives have changed so much in that short period of time. In terms of economic globalization, we've seen lots of change in who owns production, what companies exist, and which companies have risen up and which have fallen by the wayside. But there's two sort of major changes. One is that there's been vertical integration of supply chains. So you have, from the suppliers all the way up to retailers, a lot of mergers and acquisitions so that there are larger and larger companies involved in these different stages of the supply chain. And then you have different companies at the same level of a supply chain buying each other up. So eventually you have larger and larger companies at the retail level, wholesaler, and so on. What this means is that we have had larger companies involved in increasing amounts of trade across countries. And this includes Canada, of course. We're a very big trading country. And so the amount of trade that goes on in the world has increased over time, even barring what's been happening recently with trade. We reach a point, therefore, when we are having to live in a world where there are very large companies that dominate our lives, that dominate our economies, our employment, and increasingly our health. And so this is the big change over the last 3 or 4 decades, where we see companies playing a bigger role than they have previously, and the companies are larger and therefore more powerful. As a result, you have a lot of research to show concern about this trend, that there's kind of concern about types of economic activity, types of business organizations, particularly the corporation. But there are many, many other types of businesses and many other types of economic activity that has come under scrutiny. So as public health practitioners, you will be very familiar with this diagram by Dahlgren and Whitehead on the social determinants of health, which basically means all those non-medical factors that influence a person's health, including their physical and social environment, access to resources, and the conditions in which they live, work, and learn. Very, very important foundational framework for public health. But what we've seen in the last decade or so is a shift or a greater emphasis on what are known as the commercial determinants of health. So riffing off, in a way, the social determinants of health. What we've seen is increasing use of this term and a kind of attempt to use it to bring together a lot of what I've just described in a very few minutes around the rise of large companies and their role in our lives. But the commercial determinants of health, it's really important to recognize, are not new. We've had businesses, of course, operating for centuries, and we've had concerns about their impacts on human health for centuries. So you go back to the 19th century and we had the Industrial Revolution, and we had concerns raised about the impact on labor, impact on pollution, and occupational health and safety concerns, even product concerns back then. But we didn't call it the commercial deterrence of health at that time, of course. And it was not until really the relatively late 20th century that we started to see trends in non-communicable diseases rising at a rate that was alarming and unprecedented. And this raised questions about, well, what is happening here? What is changing in our world that is causing this upward trend, this kind of epidemiological shift? And so there was a lot of focus on what people called unhealthy commodities, including and led by tobacco products. And previously, there was a focus on risky behaviors, people, particularly smoking and trying to get people to stop smoking. But there was an increasing shift towards what were they smoking, what were they consuming, and it was these unhealthy commodities. And so by the late 20th century and early 21st century, what we see is a lot of research around these products, and alcohol, tobacco and alcohol led the way, but tobacco in particular because of documents that became available, and I'll talk a little bit more about those later, but legal settlements that allowed us to look into the internal workings of the tobacco industry. And it was pretty eye-opening in terms of what these companies were doing to create these products and to maximize their profits. And so this emerged as a new field, and it also aligned with the globalization of the world economy. So those aligned very quickly, and I don't need to tell this audience probably, the kind of the flurry of activity around tobacco control in the late 20th century, early 21st century around the Framework Convention on Tobacco Control. So that continued, and that accumulating evidence was very important. But by around 2010, people started to see similar patterns of activity in other industries and other product areas. And that's where alcohol and some pharmaceuticals and the food industry began to be recognized as having similar playbooks in how they created their products and marketed them. So that then led to this idea of the commercial determinants of health. So now this area is taken off exponentially. There's a lot of researchers around the world studying this, largely in Australia, the UK, and the US, but increasingly in low and middle income countries as well. So that's very exciting, and that evidence is very important for just getting a better sense of what is happening. There's efforts to measure and define the commercial determinants. What do we mean by it? How do we assess, is it getting worse? Where is it particularly impactful on populations and so on? And now we've reached a stage where we're reaching out to policymakers and practitioners, which is really who you are, to see if this can be a useful way of guiding your work. So there've been a lot of definitions. I think whenever you get academics together, they come up with definitions. And ours, mine is among these, but here's a few anyway. I'm not going to read them out, but I think the main thing is that they've become more all-encompassing as we go along. So the early definitions really talked about these unhealthy commodities or harmful products, and used terms like the private sector, the market, and so on. And really a focus on the negative aspects of these activities and products. And as you go along, you see a recognition that it's not just the companies themselves and the products they produce, but it's also the whole economic system that enables them to do these things in a particular way that is harmful to health. So as we go along, we see this evolution of this new field very quickly. So you see a shift from beyond unhealthy commodities to such as tobacco and alcohol, and ultra-processed foods is another one that's got a lot of attention, to a wider and wider range of goods and services which have negative health impacts. So we talk about firearms sometimes, gambling, fossil fuels gets in the picture sometimes too. Another change that in this field is there's impacts beyond non-communicable diseases. So that was the traditional focus, but now we're looking at accidents and injuries, mental health addictions, environmental exposures, and increasingly communicable diseases. So COVID-19 and the commercial determinants of that pandemic, for example. Another way it's changed is that the actors involved in the study of commercial determinants has expanded beyond these manufacturers of products to a broader range of actors that are located across the supply chains. So those that are involved in the production, distribution, and consumption of health impacting goods and services. And that can range from the farmers who produce some of those commodities all the way up to advertising companies or law firms or even accounting firms. And so just seeing that it's a larger operation than just the manufacturers themselves. The types of activities have been expanded in terms of interest. So many of you would have looked at some of the market strategies of these companies, you know, how they make products appealing to youth and children, how they use pricing and so on. Those are very important and familiar. There are also non-market strategies, which I'm going to explain as I go along. And then the commercial determinants of health extend beyond these big companies and what they do to the structural determinants of commercial activities. So that might be tax systems or financial markets or regulatory frameworks or lack of. Those things are also very important when we're understanding the commercial determinants. And then finally, as I mentioned, there's a shift to focusing only on negative impacts to looking at both negative and positive. So this is some of the work that we've done to conceptualize and advance this field. It's a difficult, complex area to describe and therefore to assess and measure, but we've tried very hard to capture what the commercial determinants are about. This is a definition that Nick Freudenberg and I and others have developed, but there are others. I'm going to not read these just for the sake of time, but I'm happy to share the slides with everyone and you can read them at your leisure. And then there's been a series in the Lancet recently on the commercial determinants, very rich set of papers and also conceptualization of this field. And just by this diagram, which I don't need to read, but it just wanted to show you the complexity of the field and what kind of factors have to be integrated. It's far more complicated than the Whitehead and Dahlgren rainbow. But I think I would just point to you at the bottom middle where it says ill health and health inequities. That again really just shows how the focus is on the negative. And what I really want to make sure that we understand is that, of course, there are negative impacts from commercial activities and commercially produced products, for-profit products, but there's also benefits. And so we have the production of health essential goods and services. We wouldn't be able to protect and promote health without healthcare supplies or pharmaceuticals. Unless everybody produces their own food and drink, we're going to have to rely on for-profit companies to do that. Our housing, I could go on. There's many, many products in our society that are produced by private sector actors, and we certainly don't want to say that, you know, we need to get rid of them all. The other thing is that of course, the commercial sector creates incomes for many people and generates wealth that's very important in order to keep society going. There's supply chains that are often very efficient and can be very useful for the health system. The private sector conducts a lot of research and development, and there's a lot of idea generation and innovation that happens. So by no means I would say commercial determinants of health should be anti-market or anti-commercial activity. What we want to focus on is those activities which are harmful to health and that need proper regulation, and maybe realigning the market so that it serves public interests and not just private gain. So why is it useful to the audience today, which is more removed from the research side and really into policy and practice? So there's lots of different ways that this concept could be useful to you. First of all, it helps you to understand what is happening and the kinds of problems that you're seeing and needing to deal with. So there are common causes and consequences across a lot of different public health issue areas that you will recognize and be able to make sense of with this concept. Secondly, it really enables you to share evidence and policy action across these issue areas. So you may have colleagues that work in some of these other areas like gambling or climate change or alcohol policy. And those colleagues can come up with ideas that may be relevant to tobacco control. We also want to make sure that the concept helps us shift the research, policy, and practice from a heavy focus on behaviors, which are always important, of course. We ultimately want people to change their behavior, and also, of course, companies to change their behavior, but we also have to understand the key drivers of that behavior, whether it's the underlying norms and values or the financial incentives, whatever it is, but we have to understand the broader context. And what's very useful about commercial determinants, it actually it reveals a lot of these hindering factors. They're often hidden that prevent effective policy action from happening. And often you'll have this almost feels like a no-brainer policy where, you know, many people are impacted. What we need is this regulatory tool, but for some reason, this is not getting through the political system. And it just helps you understand why that is. It sometimes doesn't make much sense from a public health perspective. And then finally, we want to promote understanding of how health harming industries are enabled by the broader systems in society. We may not be able to impact those because they are very macro, but we can at least understand where the levers might be, or at least where we can try and influence those who can change those things. So let me start by just going through what commercial determinants are in a more specific sense. I probably don't need to say too much about the market strategies. As I say, I think these are the most familiar to people in public health. You see them every day. You're trying to battle them. It can range from how products are packaged and marketed, use of flavors, use of advertising, and it has become more subtle with tobacco. You know, there's a lot of strict rules around tobacco advertising, but you know, there are ways that it can still be promoted and sponsoring different activities, but other sectors as well, other industries use these market strategies to ensure that they reach their customers, that they maximize their return for their investors and so on. So you know, we see this all around us. We see processed foods and children are a particular target because, of course, they are the future consumers. So we see this all over. Non-market strategies are more often difficult to see, but they are equally important. So non-market strategies, they focus on building relationships, not with the consumers, but with external stakeholders. And that might be government, it might be regulators, the public, sometimes that might have a sway over what government does, and other non-market entities like perhaps labor unions or industry associations or even researchers. So a good example is how we just had an election in Canada, how commercial interests might fund political parties. So in Canada, actually, we have very strict rules about how much campaign contributions an individual or an organization can make to specific candidates, to specific political parties. And so we have some degree of limitation on that and hopefully can keep things safe from undue commercial influence. That's not always the case, but the rules are stricter. In the US, what we see is a much looser situation. So you have a lot of companies contributing quite substantial amounts to political campaigns and to elections, to individuals, to parties, to all sorts of political activity. And I'll leave it at that. In Canada, what we do have are what are called lobbying, of course, of different officials, different ministries by commercial activities. And there are records of this, which you can analyze. Some of them are health related, some are not. But you can see in this chart really some of the federal lobbying contacts that were taking place between around 10 years time, and where what issues or which policy areas were lobbied and by whom. So that's an important way of being transparent. And sometimes you can identify, concerning patterns if there's too much lobbying going on. Oftentimes that suggests that there's some undue influence there. I would mention my own area, which is research, which gets very much a lot of funding from the commercial sector, not necessarily public health research, but sometimes it does. And so some of our research has really tried to reveal where tobacco money in particular has gone to quite prominent researchers at times. And so a researcher we looked at was Hans Seeley, who was funded by the tobacco industry to research the subject of stress, which is something, of course, that is important for mental health. But he created this research program because it was an alternative way of explaining maybe cardiovascular disease or people's reliance on substance use. And so it was kind of a distraction. And this is really a sign that the tobacco industry was trying to throw attention away from the harmful effects of cigarettes and so on. Another was around in China when they were trying to show that liver disease was a higher priority than say lung cancer. So there's a lot of efforts in other countries to reprioritize research and therefore the policy agenda. The tobacco industry also has a good relationship with the media, and so you often have to look at where media stories come from and why they're reporting in particular issues in different ways. It's not only the tobacco companies, but also sugary drinks, for example, when there was debates around sugary drink taxes. So those are the market and non-market strategies. It's really important to be really aware of all that's going on. But we also have to look at beyond the behavior of companies and commercial actors to those structures and systems I was talking about. So in any country, in any policy context, we have political systems, we have economic systems, we have laws, we have ways of collecting taxes from who and how much. And all of this is really indicative of where and how commercial influence can take place. So in some countries, there's very rigid rules about how much lobbying can take place, how many political campaigns can be receiving money from commercial activities. There are laws around disclosure, around conflicts of interest. That's all incredibly important. That's not always the case in a lot of countries. And what you see is a lot of these structures and systems actually designed to either not reveal what is going on or even enabling a lot of the commercial activity that happens. And so all of this sounds a bit, overwhelming in ways. Yes, the commercial sector is incredibly powerful, incredibly skilled and well-resourced, but there are ways that the public health community can respond, can ensure that, that there's some checks and balances in how commercial activity takes place. And so we wrote a paper for the annual review of public health, which sets out some of those strategies that have been based on evidence so far, and we reduced them down to 5 key strategies. Most of the public health promotion area focuses on the behavioral change side, so I'm not going to talk too much about that, but I'll skip over that. And then there's the regulating those practices I told you about. There's some fiscal policy strategies, citizen and consumer activism, which is growing, and then litigation. And so behavioral change is very familiar. It's trying to change the behavior of consumers in whatever way you can, whether it's informing individuals of what products contain or what they can do for to your health in terms of harms, to trying to promote more positive behaviors. You can also, use all sorts of strategies to do that. Counter marketing strategies are very, of course, effective. mimicking often advertising to get the message across using humor and so on. And of course, changing the ability of people to make healthy choices. That's incredibly important. So enabling healthy fruits and vegetables to be available is one example. And so we have lots of examples of really impactful health promotion efforts to try and change behavior. I think we're pretty good at these things, although increasingly we realize that there's only so far you can go with changing people's behavior. There's a lot more going on with the commercial determinants of health than that. And so we realize that they're also regulating the marketing practices of companies. So they have great skill at convincing people to use their products. And that's across the board, in terms of the range of consumers, but also the range of products. So they can nudge the behaviors of, we can use regulation to nudge the behaviors of commercial actors who will, because of the way that is their purpose, maximize profit, returns on investment, revenue, shareholder value, and so on. But we can nudge them in ways that are less harmful to health or more promoting of health. And that might be through, for example, regulating product ingredients, manufacturing process, packaging and labeling. We do that with tobacco, obviously very strictly. We can regulate product marketing, and that again is quite strong in the tobacco area, but not in other areas of harmful products. So we have to span advertising, sponsorship, and promotion. And when in the digital space, that's become a more complex challenge, but there's a lot of ways we can do that. We can regulate the product's accessibility, whether it's by age, by location, and ensure that those who we don't want those products to reach, we restrict that. We can also regulate product availability in different ways, such as through vending machines in schools. And I think, sugary drinks, vending machines, for example, have been removed from a lot of schools, community centers, and so on. Point of sale marketing, so that you cannot now go into a shop and see all these products, of course. But there's still things like sweets or candies at checkouts, and so on. Some countries have adopted zoning areas or zoning rules where you cannot locate a vape shop, for example, within a certain distance from school. I don't know how much in Canada that's happened, but certainly that's something that other countries are trying. And then finally, creating and enforcing standards for market practices, so that often is the case that the industries will create voluntary codes, but really these need to be initiated independently and then enforced by non-industry actors. And so here's again some that you'll be familiar with. These are old-fashioned, of course, because a lot of this is no longer allowed, this kind of promoting tobacco products, but it still does exist around the world, and it is a global industry, of course. But we have made progress in Canada. There's a lot more restriction in terms of packaging and advertising and so on. The regulation of non-market practices is something that is probably more recent. So we have regulations that do try and change the behavior of commercial actors when they try and interact with government, with other stakeholders that shape their profit-making activities. And so, for example, we can put up firewalls. We can say, look, no, you cannot lobby or be involved in any policy that involves public health if you are a company that's involved with tobacco production, for example. And we have that under the FCTC Article 5.3. But that does not exist in other areas at the moment. We can adopt laws that require declarations of conflicts of interest, and I know all of us are subject to this all the time. I certainly am as a researcher. In every paper that I write, I have to declare all my conflicts of interest, any funding that I've received. But that's not always the case when, for example, you read a story in the media and somebody writes an op-ed they often don't declare who they are and what money they've received. They might sound like an independent person with an informed opinion, but in fact they are often, as we know, being paid by a certain industry. So that's not always very transparent. We can also create rules that require people to declare, for example, organizations to declare. We have a lot of industry-funded organizations that the public doesn't actually realize that they're funded by vested interests. And so requiring them not only to declare that funding, but to report on how much and when and so on would be a really big step forward for provinces and the country. And then finally, in the research sector, that is something that is very poorly regulated. Universities are short of money always and are seeking endowments or advancement of some kind. And it often involves companies and private sector contributions. And there are chairs endowed, there are scholarships, naming rights to rooms, and so on. I think there has to be questions asked about the ethics of some of the funding that's received. And I know a lot of universities are now have policies not to accept tobacco money, but not all of them. And certainly not in my university at Simon Fraser University. We've tried to push for this and that hasn't been possible for some reason. But oil and gas is another industry that people have raised questions about and so on. So that's something that really at least needs to be more transparent. And so we see examples of this, just give you this slide really, showing lots of different influence. And I would draw your attention to think tanks, which are, when people think of think tanks, they think of them almost like research institutions and maybe independent. There's, for those members of the public aren't familiar with think tanks, they don't realize that, but they are often paid by or funded by vested interests, big companies who channel money through them, and then the think tanks will produce reports and opinions that will reflect those funders. There's a I won't go any more further on that, other than that to say that this is not just a one-off pattern, but our research showed, we published a paper on what's called the Atlas Network, which is a network of think tanks that are worldwide, and it includes the Fraser Institute here in Vancouver, which is a very coordinated group of think tanks that receive funding from corporations, that publish opinions about certain policy areas, including tobacco. And most of them will not surprise you in the sorts of things that they produce as a result, and that they continue to do so without declaring those interests. And that's because they aren't legally required to do so. And so this is the kind of reports that have come out from the think tanks, and which really make your lives difficult because they look like research papers and reports, and they really are undermining independent research and public policy efforts. Fiscal policy strategies are really important. I know that it doesn't fall within your purview, but it's really important to advocate for the use of fiscal policies that really do change people's behaviors and also those of companies. And so we talked about taxation previously with sugary drinks. There are also other ways that fiscal policies can be used. It might be around minimum pricing of certain products to ensure that they aren't too affordable especially to youth, but that they need to be beyond a certain price affordability for consumers. We know about so-called sin taxes, which I don't really like that term, but those are used very often on products that people we don't want high consumption. There's other ways we can use tax incentives to nudge people towards healthier behaviors. And we can encourage investment in areas that will will allow commercial activity to provide healthier options for example, rural and remote areas and food deserts, which is something really a big problem. And there's just some slides really to show that. And there's lots of different ways. You know, sometimes some governments are actually paying or providing free products to support swapping away from smoking. For existing smokers, of course, not non-smokers, and so on. Litigation is an area that I think we have been hearing about in the news, but has probably not been used as much in Canada than the United States, which has had some very prominent cases. But it's just basically using the courts and legal system to force commercial actors or even the government to end harmful practices and determine liability for those harms that have been produced. So there's been a slew of individual and class action lawsuits directed at companies to try to hold them responsible for the harms that their products have produced, based on negligence, based on product design, based on misleading claims and fraud, and the addiction that has been caused by the products. So we know about tobacco, but we now know about opioids, and gambling is falling into that as well in terms of addiction. We have seen governments try and recover costs to society from these products, whether they're healthcare costs or wider social costs. There are penalties that the courts can inflict on the practices of companies if they are persistent in creating harms, not just to individuals, but to society. For example, pollution, wider pollution, or product waste is another. And of course, tobacco has a lot of product waste with cigarette butts. And there may be, you know, a call for penalizing companies for creating a product that leads to such toxic waste in our environment. My area that I've looked at for years is around tobacco smuggling. And so we've had a lot of papers, and I'll show you in a minute, looking at how the tobacco companies have denied involvement, but in fact have been very complicit in that illegal trade. And that's led to tax evasion, increased supply, and so on. So how do we know all this? From the legal side, it's really useful for tobacco control advocates that these documents that were made available in the late 1990s and continue to be disclosed with new legal cases provide a real insight into how companies operate. And these early documents in particular are more candid because they never expected them to go into the public domain. And so we learned a lot about, first of all, how these companies operate, both legally and illegally around the world. And so that effort took place over a 10-year period. It was a very large effort by my team in London to make publicly accessible online these 6 or 7 million pages of British American tobacco documents, many of which are relevant to Canada. From that, we used those documents to really analyze contraband tobacco, cigarette smuggling around the world. And this work was really important, not only for revealing what was happening, to show tax revenues were being lost, but also health harms. And it also led directly to this protocol to eliminate tobacco, illicit trade in tobacco as part of the FCTC treaty. So there's an example of how research can really feed into policy and international law. I just wanted to mention one of the papers, or two of the papers we wrote, was on Paraguay, and it just wasn't just the large usual suspects tobacco companies that were doing the smuggling. It was actually a company in Paraguay that was owned by the then president of Paraguay. We were very careful when we wrote these two papers, and when they were published, that they really stuck closely to what the evidence showed in the documents, and put it out there. And it got coverage in the region quite substantially by local newspapers. So that was fantastic, a really, really good result. And it also led to, I don't think I've shown this, but it led to some changes in and prosecution of that individual. And I'm not really sure what's happening at this point, but certainly there was a lot of questions raised and some investigations initiated in the country. So of course we have our own legal system and we have our own ability to mount these cases. They're incredibly expensive to mount, and you really have to have patience because they can drag on for years. But as you know, we had our settlement with tobacco companies recently in December 2024. We've also had cases settled around the opioid crisis, which is a huge problem caused by certain pharmaceutical companies and their marketing practices. We know that. There are others around the world who are using the legal system to hold companies to account. I'm going to speed up a little bit. I think we're almost at the end here. Consumer activism isn't something that you necessarily do, but it is a way that the public is becoming more active in the kinds of products that it's exposed to and the kind of way that companies behave. And so I think revealing to the public what these companies do using the commercial determinants of health framework actually gets the public on our side. I think at this time, the public health community is not always seen in a positive light. And I think it's pre-COVID in terms of, people not wanting to be told what to do and being, the so-called nanny state. The commercial determinants of health actually help with that narrative because it really shows that it's not public health people that are trying to control your behavior. It's actually the commercial actors. And if you have documents to back this up, often there's a very compelling story to tell about how that is achieved. And that can really change public sentiment towards companies. Of course, the companies don't just sit there and, take all this criticism. We have had a lot of examples of where commercial actors have pushed back. And there's been some very orchestrated campaigns, some of it based on misinformation to really discredit, for example, WHO, to discredit the public health community, to discredit researchers. And so that's really something that we have to be aware of, and we have to have a strategy to deal with that. We can't just let it land. It's incredibly harmful. And so as someone who's on the editorial board of this report that is due to be published later this year, I'm sort of bracing myself for the pushback. We already know that the US is withdrawn from WHO or will be soon. We also expect that many commercial actors will be pushing back. And for me, just to wrap up, we can say, okay, this is tobacco and this is, the government, that public trust in Canada is declining, and that one might say, well, it's the fault of government and so on. But the data seems to show that public trust is actually in decline across the board, and it includes large corporations. And so it's really important that people in both the public and the private sector recognize that the public have great concerns about how the two operate together and how they are not operating for the benefit of the larger public. And so a lot of the trends that we're seeing is concerning and behind a lot of the polarized politics that we're seeing. So I'll just end by saying that there are opportunities to think about commercial determinants in a different way, that we are not about anti-market or getting rid of the private sector or commercial activity. We absolutely need commercial for-profit activity. What we don't want is an economy driven by wealth generation and wealth creation that is concentrated for the benefit of the few and at the detriment of public interest. And so there's this concept of well-being economy, this concepts of quality of life, frameworks that I know the federal government has looked at. There are public benefit companies that are now in the US that they've created where they must demonstrate some social and environmental value is part of their DNA. And I know that only BC has the opportunity to register companies that are public benefit. Other provinces have not yet taken that up. Sorry, I'm gone over time, I believe. So I'll leave these key messages here. I won't repeat because I know I've run short of time. But thank you very much for listening, and I'm happy to answer questions.
Great. Thank you so much, Dr. Lee. That was an amazing presentation, lots of content. And as mentioned previously, the session is being recorded, so it will be available. And Dr. Lee has offered to share her slides as well. So we have a few questions that we'll try to get through, and any ones that we don't get to, Dr. Lee has also offered to help respond to them offline as well. So I can help facilitate that offline if there are questions that want follow-up after the session. So the first one kind of transitions from how you left off on your presentation. So the question is around, can you speak how the commercial determinants of health frameworks can be useful for analyzing unequal access to healthy products such as medicines, or in addition to the usual focus on unhealthy products such as tobacco, alcohol, those sorts of things?
Thank you. It's a great question, and it's an important one because it shows what you're trying to do is pull out and look at the bigger picture, and I really encourage that. So in any community, we have inequitable access. It might be certain community members can't afford a product, or it might be because it's not available in that area, or it might be a geographical problem, with food deserts and so on. And so you really have to look at both supply and demand. And this gets into, the economic side of things and how things are produced, distributed, and so on. So part of it is demand. So, can a person afford? And that is kind of like social policy area. So you might need to enable subsidies or some sort of price reduction or some ways of making a product more affordable. If it's an issue of availability, then there's issues around supply. And then you might encourage certain suppliers, maybe through tax breaks or through encouraging investment, might be some co-funding to enable supply to be increased to certain areas or to certain neighborhoods. And so there's lots of levers that governments can use. They do this all the time with certain things that they want to promote versus things they want to kind of discourage. So I would just kind of encourage the public health community to look broader to all those policy levers and the way that supply and demand can be managed in a way that's beneficial to health and equity.
Great. So the next question that we have is, do you have any advice on how to move action forward on the commercial determinants of health when governments aren't supportive of efforts to regulate or tax products? So the example provided was alcohol taxes or availability. I'm sure we can apply that to many substances as well. There seems to be less desire to regulate or tax at this stage.
Yeah, and it varies from province to province and country to country, I realize. I think, when public health people want to reduce raise the cost of certain products through taxation, there is a pushback from the public because they're just making it more expensive for those people, and then there's a lot of unhappiness. I think it comes down to the rationale, and so often public health community relies on showing the health harms. So many people become ill or die from this product. This is the outcome. And there's this kind of, feeling that, oh, if we just increase those numbers or, gather more numbers and so on. And for those who are making the decisions beyond the health sector, those aren't the metrics that people make their policy decisions by. And these are often policies made by the finance ministry or a ministry outside the health ministry. And so you have to kind of start talking about other things. And with tobacco control and the FCTC, it was really about widening the rationale for why we needed a treaty. And it was working with the World Bank, for example, and showing the cost to society from tobacco use. It was a net loss rather than a net gain, because often these industries say we create a lot of jobs and, you know, we make people happy and whatever it is. And really what you want to show is the economic loss to society, whether with alcohol, it's, you know, the violence that happens with drink driving. It might be with tobacco, it was not only the costs to healthcare, it might be house fires, it might be loss of employment, productivity. You know, really kind of think about what would appeal to a finance minister if you're trying to increase taxes, because all they care about really is like, how does that impact the economic well-being of a society, rather than, you know, the kind of things that we're primarily concerned about. I think that's just an example. I think there are other ways that we can think about, you know, engaging the environmental ministry or the education ministry, but there are different arguments made to different parts of government, and then those alliances can be built. You don't have to support a policy for the same reason, but if you can get a coalition of ministries behind a policy for different reasons, that's quite powerful.
And have you had any examples more from like a local level perspective? So maybe regional or local government where they've been able to make some advancements in dealing with some of the harms that they're experiencing from the commercial determinants of health, or trying to adjust their policies?
I would say, I think a large amount of the commercial determinants activity is often at the local level, municipal level. So the municipalities in the US and in Canada have been more forth, have been more advanced in kind of adopting the taxation around sugary drinks, or trying to regulate sugary drinks, taking them out of community centers or local, you know, local venues where children might be involved. There's a lot of push from the ground up. It's, of course, we need to have these adopted at the provincial level and ideally at the federal level. There's lots of different complicated levels of government, but it's often at that ground level because it's where I guess it's most visible. And you know, the issue around cigarette butts, for example, is so visible on the ground, and cities have been spending a lot of money sweeping up cigarette butts for generations, and so they bear the cost. And so I think that would be, you know, often the case that you have this campaigning to deal with an issue comes from the ground up. And I think if we can kind of find a way to engage actually as we go up to the provincial level, for example, and again use those diverse rationales, that would be great.
Great, thank you so much. And I know there's more questions in the chat, and unfortunately, we're reached our end of our session. Thank you again, Dr. Lee, for your amazing presentation. It was really great having you today. And thank you to all of you who joined today, and our events team who's working behind the scenes, helping to get everything up and running today. And one last piece is there will be a survey that is sent out. So we ask you to take a few minutes to fill out the evaluation and send it back. And that really helps us with our future planning. So thank you all again, and I hope you all have a great rest of your day.